Hi, and welcome to the Ankota Training Academy. Let's get started.
Hello, and thanks for joining today. One of the big questions that gets asked very frequently is among people who are trying to start a home care business is, what am I starting a home health agency or am I starting a home care agency? And what's the difference between these things? So I'm going to start by saying that home health and home care, you can't even go by the name of the company, but these are two very, very distinct kinds of businesses, and I'm going to explain that. Now, the backdrop of this, what you see on the screen, is this web resource. It's called the Ultimate Guide to Starting a Home Care Agency. And just to kind of jump ahead a little bit, this is more focused on what we're calling home care as opposed to home health. But let's kind of get into that right now. So first of all, there's a lot of interest in this. We're getting this question a lot because really a lot of people are saying, hey, home care or home health care is a business that I want to get into. So I'm making this video in 2020, which I'm going to call the times of COVID. And a lot of people are saying, hey, we'd rather have people cared for in their homes than in nursing homes. And that even the hospital world, and even, if I get more specific, even treating people for COVID is an area where a lot more people and a lot more health systems are saying we should treat people in the home because they're less susceptible to either infect anybody else or to catch other diseases, which unfortunately when you're in the hospital you're susceptible to catching other diseases. So that's why there's so much interest. And real quickly, this guide is broken into chapters, and it talks about all kinds of things that you want to do for starting a home care agency. But I want to focus on the question of today. So I'm going to jump right to this chapter of what is home care, and it's right here. So really, home care, I guess just to start with the definition, in general, when somebody says home health care, they're talking about nursing type of care. So this is a medical kind of care. Home health care officially usually happens after somebody gets discharged from the hospital. So let's say that we have somebody who had a hip replacement and they need help with, really recovering from that hip replacement. So there's going to be healthcare resources in the form of nurses and physical therapists primarily who are going to work with this person and make sure that, first of all, that the pain is managed, that the wound, from their surgery, since they had to make incisions to do the hip replacement, that those wounds are healing well, and those would be taken care of more by a nurse. And then when they look at the other aspects of, when you've had a joint replacement, let's say, there's going to be a lot of scar tissue and a lot of stiffness, and you need to build the muscle, and you need to go ahead and really kind of fight against that scar tissue and get the range of motion and mobility back. And that's going to be mostly done by a physical therapist. And that's what's called home health care. So health care is, if we think about it, I mean, if you're listening to this video and you're thinking of starting some kind of a home care agency or home health care agency, you're probably a younger person. So by means of analogy, at our younger ages, we go to the doctor for certain things. We're sick, we broke our ankle, our kids have an ear infection. These things are all healthcare, but then we think of other things that are more, wellness oriented, like you might go to yoga or you might be a member of a gym, and healthcare doesn't pay for those things. That's kind of more, wellness and care for yourself, whereas healthcare is very, very specifically, focused on medical needs. Well, now if we put ourselves in the shoes, not of ourselves, but of a 80-year-old, let's say, and they're going to need home care, they might need it for two reasons. They might need it because they're recovering from a hip replacement or a knee replacement or, congestive heart failure episode, whatever it could be. There's lots of reasons why they might need health care, but there's other reasons why they might need home care. And in this case, what home care is help with what are called the ADLs, or activities of daily living. So here I'll highlight that here. So basically home care, and some people call it non-medical home care, but this is care that helps people with really the things that they need to just live their life and live their life to the fullest. And the very, very basic needs I'll highlight over here, like eating, hygiene, bathing, toileting, companionship, right? So there are agencies that are called home care agencies, and they provide this service. And right here, there's a list of other, let's say synonyms for those is non-medical care, private duty home care, which implies that the clients are paying directly out of their pocket, companions, homemakers, home health aides. This is what we're talking about as being home care. And then if I scroll down, this is what we're talking about. Most of these are in home health. So home health care, that would be our nursing, and that would be our, as I said, home physical therapy, occupational therapy, speech therapy. And while we're here, I mean, there are other types of, near neighbor businesses, like so people who are delivering medical equipment and providing services around those. There's some people who are getting infusion therapy at home. There's something called hospice care. This is for the very end of life. And then we get into our institutionalized care. So that would be like more a nursing home, I guess I'd say institutionalized care, whereas assisted living would be, something more like where you have an apartment in a complex with other elderly people, and generally assisted living, has people who check up on you and often like central meal service. So, bottom line, and I actually found this infographic that we didn't make, so I want to give credit to somebody called Invoiceberry because they made this. And they made this infographic that really kind of described home healthcare as nursing services, so people who deal with medications and blood pressure cuffs and and voiding and wheelchairs and things like that. So that's your medical care. Whereas this home care, this non-medical care, is all about dressing, grooming, companionship, and that help with the activities of daily living. So that's my best shot at giving a definition to this, and I hope you've enjoyed the video. Have a fantastic day.
Thanks for watching this video from Ankota. For further information, scroll down and click on the link in the video description below. Have a great day.